In this video, here's what we'll cover: what relationship OCD really is, the signs, obsessions and compulsions, how it differs from normal doubts, the ripple effect on partners and families, how treatment can help. Have you ever lain awake at night, turning one question over and over in your mind? Do I really love my partner? Is this the right person for me? Most of us have moments of doubt in a relationship. They come, we talk them through, and they pass. But for some people, those doubts do not pass. They arrive dozens or even hundreds of times a day, loud and urgent, and no amount of reassurance makes them quiet down. If that sounds familiar, I want you to hear something clearly. This is not proof that your relationship is wrong. It is not a sign that you are broken, or that you love badly. It may be a recognized condition called Relationship OCD, or ROCD, and it is treatable. Let me start with what ROCD actually is. It is a form of obsessive-compulsive disorder where the unwanted, intrusive thoughts focus on your romantic relationship. These thoughts create real anxiety, and they push you toward repeated behaviors to try to ease that anxiety. The doubts are not based on a genuine problem between you and your partner. They come from the anxiety itself. OCD affects roughly 2 to 3 in every 100 people, and relationship worries are one of its most common themes. So if you are living with this, you are truly not alone. Now, the signs. ROCD tends to show up in 2 parts, and they feed each other. The first part is the obsessions, those intrusive thoughts. They might sound like, do I love my partner enough? Am I with the wrong person? Is my attraction real? Does this feel right? The thoughts pop up again and again, and they make it hard to focus on work, study, or anything else. The second part is the compulsions. These are the things you do to try to feel better, constantly asking your partner, your friends, or your family for reassurance, checking your own feelings, watching your body for a spark, comparing your relationship to other people's, or to your past, spending hours reading about relationships online, mentally replaying old moments, hunting for proof that the love is real. Each of these brings relief for a moment, but the relief never lasts. And over time the checking and seeking actually make the doubt stronger. So how is this different from the normal doubts everyone has? It is a fair question, and the difference really matters. Ordinary relationship doubts come and go. They tend to be tied to something specific, and they settle once you have talked it over. They do not take over your day. ROCD is different. The doubts are constant and intrusive. They feel urgent and overwhelming. No amount of reassurance gives lasting relief, and they can eat up hours of your time and leave you exhausted. One useful clue is that these thoughts usually clash with what you actually want. Deep down you may love your partner very much, which is exactly why the doubt feels so distressing. Living this way takes a real toll. Many people carry chronic anxiety, low mood, and a heavy sense of guilt or shame about having the doubts at all. Some become so busy analyzing their feelings that they struggle to actually feel them. Sleep suffers, concentration slips, and here is the part people often miss. ROCD does not stay with one person. It ripples outward. Think about the partner on the other side of it. They are often confused and hurt, unsure why their reassurance is never quite enough. Giving the same comfort over and over is draining, and many partners start to feel inadequate, or begin to doubt the relationship themselves. Unhelpful patterns can set in, where the relationship starts to revolve around managing the anxiety instead of simply enjoying each other. Families feel it too. Parents watch someone they love struggle in what looks, from the outside, like a perfectly happy relationship, and they feel helpless to know how to help without making it worse. Friendships can strain when every conversation circles back to the same worry. Here is the hopeful part, and it is a big one. ROCD responds well to treatment. In my practice, the approaches with the strongest evidence are cognitive behavioral therapy, often shortened to CBT, and a specific form of accord exposure and response prevention, or ERP. CBT helps you notice the unhelpful thought patterns and gently challenge them. ERP is considered the gold standard for OCD. It means slowly learning to sit with an uncomfortable thought. For example, maybe I am not sure, without rushing to seek reassurance or check. Over time, the anxiety around that thought fades. Studies suggest that somewhere between 60 and 80% of people who complete ERP see a real reduction in their symptoms. Other approaches, including acceptance-based therapy and where past trauma is involved. EMDR can also play a valuable part, and for some people medication is worth discussing too. Recovery does not mean you never have another intrusive thought. It means those thoughts lose their grip, so you can respond calmly and build a relationship based on genuine connection rather than constant checking. If any of this describes you or someone you love, please reach out. Getting help early makes a real difference. At our Potentialz Unlimited practice in Bella Vista, we offer evidence-based support for our OCD. You can read the full guide or book an appointment using the links in the description below. Before you go, here's a quick recap of what we covered. What relationship OCD really is, the signs, obsessions and compulsions, how it differs from normal doubts, the ripple effect on partners and families, how treatment can help,